So I am focusing on the community vaccination clinic at Common Ground, where you were speaking a few weeks ago over in Cedar Grove.
Right.
And I wanted to ask you specifically about why these community vaccination clinics, bringing the vaccine into these neighborhoods, is so effective and important.
Right. Early in the pandemic, we were, fixed and really mass vaccine. People could drive in, drive up, drive through. And that's a very effective way to handle hundreds to thousands of people a day. And that's sort of phase one of deployment. Those are the folks who are most anxious and urgent to get vaccine. Phase two is where we're still at, which is really bringing vaccine to where people are, and that's through community events and sometimes festivals and fairs, but those haven't really paid off as much as others. But bringing vaccine to where people are at community events or community hubs of activity is very effective because it's more personal. It is also, people are on their home turf. They're more comfortable. They're also more comfortable asking questions, getting information, and especially for those who have hesitation, they can get their questions answered right there, one-on-one, person to person. So we find that very effective at this sort of phase two of vaccine deployment.
What were some of the questions that community members in Cedar Grove were asking you when you were at Common Ground a few weeks ago?
Right. So there were some more general questions about, how is this vaccine different than other vaccines, and how it's made. The fact that it's an mRNA vaccine, what does that mean? Some fundamental questions about how vaccines work. There was a lot of interest and concern at some points too about the side effects of the vaccine and what is expectable and what is outside the range of sort of normal in terms of side effects. So it was a great opportunity for dialogue, because, and for me especially, getting out in the community helps me to get a pulse on where people are, what is their understanding, and what are their concerns. So it was good.
Talk to me a little bit more about the trust that is found in these deep-rooted establishments that have been in these communities for years versus going to the doctor's office or going to a drive-through vaccine clinic.
Right. So there is different maybe quality of trust in each of those different situations. Of course, I've been tried to be very public, very available to answer questions, and I've made it clear there are no dumb questions, and I'm happy to answer questions for folks, and in one-on-one meetings or in civic meetings or other things. But again, when we're in a community center or hub like that, folks are on their own home turf, and they feel sometimes more empowered to ask questions. They are able to gauge from some of their peers, sort of what are their concerns, and maybe one person has a concern but is not ready to speak up, but their friend will speak up for them or ask that question for them. So that type of interaction, I think, is really helpful. The medical interaction with a doctor in a doctor's office, we know, is complicated sometimes. You're out of your comfort zone, and there's a lot of research that shows that patients often don't tell their doctor things that may help their medical care, and don't ask questions of their doctor when they have concerns. And so knowing that helps us justify and really put our energy into going where the people are.
So I'm looking at state vaccine data right now from LDH, and just in the neighborhood alone where the Common Ground organization is, Cedar Grove,
right,
just about 27%
right,
of that neighborhood is vaccinated. If you go just over the interstate to the west, the number's even lower, 23.7%. Yet if you go maybe a half a mile to the east, you're looking at a near 60% vaccination rate. What does that tell you about vaccine hesitancy in this community?
I think it tells us a few things, and usually brings up more questions than answers. But I think there are a lot of factors there, Christian. One is, yes, there's hesitancy, and that may partly be related to mistrust of medical establishment. That may also be related to not having long-term access to good health care, or not really being comfortable utilizing good health care. Because even though LSU Medical School and our clinics and Ochsner clinics are right there in their background, some people just decide they don't want or need to take advantage of those resources that are available. And so I think there are a lot of factors that play into those low rates. For me, and I think for all the physicians and healthcare individuals around, that really boils down to trust. And the closer our relationships can be with folks, one-on-one, answering questions and being available to them. And I, you've heard me say before, I'm a fan of Tom Bodett. We'll leave the light on. Bringing people to decision making in their own timeline is going to be the most effective.